Hello guys, welcome to our YouTube channel. Today we want to speak about kidney donation. So if you are interested in this topic, please be with us until the end of this video. Living kidney donation is when a healthy person donates one of their two kidneys while they are alive. Getting a kidney from a living donor has lots of benefits for the person who needs a transplant, called the recipient. If you are interested in donating a kidney, you will work with a transplant center at a hospital. The transplant center will make sure you are healthy enough to donate, do the surgery, and help you recover. There are a few common requirements for people who are interested in living donation. You must be at least 18 years old. Some transplant centers require a donor to be 21 or even a little older. There are some medical conditions that could prevent you from being a living donor, including having uncontrolled high blood pressure, diabetes, or cancer. If you are a smoker, you will most likely be asked to quit before being approved to donate. You should be honest with the team about your smoking habits to make sure that the donation and transplant are successful. There are two types of living kidney donation. Directed donation is when the donor names a specific person who will receive the kidney. It is the most common type of living donation. Direct donations are often between blood relatives, like parents, siblings, or children. They can also happen between people with close personal relationships, such as a spouse, friend, or coworker. Non-directed donation is when a person donates anonymously to someone in need. They usually do not have any kind of relationship with the person who gets their donated kidney. Other names for a non-directed donor include an altruistic or good Samaritan donor. If you are planning to donate to someone you directly, there is always a chance you will not be a good match. Maybe you and the recipient do not have blood types that work together, or there can be other factors that would not allow the transplant to be successful. If you turn out not to be a good match, another option is a paired exchange. A paired exchange involves two pairs of living donors and their recipients. The two recipients swap donors so that each receives a kidney from the other person's donor. If this is an option for you, your transplant team will coordinate the entire process, including finding the other matching pair. While there are no physical benefits for a living donor to donate a kidney transplant can save the life of someone with kidney failure. People with kidney failure who receive a transplant can live longer and enjoy life more, especially giving them freedom from staying on dialysis. Getting a living donor transplant has several benefits for the recipient with kidney failure compared to getting a deceased donor transplant. A short wait. Having a living donor means the patient no longer has to wait on dialysis. If someone has kidney failure and can find a donor before they need to start dialysis, they may be able to get a preemptive transplant, meaning they don't have to go on dialysis at all. Some living donor transplants are done between family members who are genetically similar, but you can be a great match with someone you are not related to. A better genetic match lessens the risk of rejection. On average, a kidney from a living donor lasts about 15 to 20 years, compared to 7 to 10 years for a kidney from a deceased donor. Some will last longer, others will last less. Living donor kidneys also have a better chance at working right away than deceased donor kidneys. Just like having any other surgery, there are risks involved with having a living donor surgery, like bleeding or getting infected in the areas around the surgical area, developing a hernia if you lift anything too heavy right after surgery, getting a UTI or urinary tract infection. This can be caused from having a urinary catheter placed during surgery to allow your body to urinate while you are in a surgery and under anesthesia. Thank you for being with us until the end of this video. I hope this video helps you to know more about kidney donation. If you are interested in medical world, don't forget to subscribe our channel and see our other videos.